Good afternoon. This is Dawn Fuller, Auburn University School of Nursing, nurse practitioner student. Today we're going to talk about Helicobacter pylori. Helicobacter pylori is a spiral-shaped microaerophilic gram-negative bacterium. The bacteria's urease motility and ability to adhere to the gastric epithelium allow it to survive and proliferate. The enzyme urease, which is produced by the bacteria, decreases the acid in the stomach. This bacterial infection of the person's stomach can create open sores, such as ulcers in the lining of the stomach or the duodenum, cause gastritis, and may lead to stomach adenocarcinoma. H. pylori is one of the most common chronic bacterial infections in humans, and 25 to 35% of people in the United States are affected by it and unaware they have it. The risk factors are contaminated or untreated water, contaminated food, living in unhygienic or low socioeconomic conditions. African Americans and Hispanic individuals are affected more by it, as well as the older adults. Close contact with infected saliva, feces, or vomit can transmit the bacteria. An increased risk is involved in cigarette smoking and excessive alcohol intake. There are essential evaluations that need to be done when you're looking at a patient. You need to assess their abdominal pain, if they have any nausea or vomiting. These symptoms can be gnawing, burning, or aching between the belly button and the breastbone. This pain is usually relieved by antacids. Patients may have a loss of appetite, a loss of weight. They may have blood in their vomit. It may be bright, frank blood, or it may be coffee ground-like, and they may have bloating or nausea after eating. Patients also need to be checked for the use of long-term non-steroidal anti-inflammatory medications, which can impair the barriers that protect the gastric mucosa and suppress gastric prostaglandin synthesis. NSAIDs also reduce the blood flow to the gastric mucosa, which interferes with the repair of superficial injuries to the lining of the stomach and can lead to gastric ulcers and bleeding. You also need to assess their bowel habits if they're having any black tarry stools or blood in their stools, which would be indicative of a GI bleed. Several components of the physical examination, one that you always include, will be your general history, vital signs, and lifestyle history. You need to assess their cardiovascular status, which they may present with chest wall tenderness. They also may present with skin pallor or conjunctival pallor in the eyes. The biggest thing to look for is in your gastrointestinal section. They may have abdominal tenderness. You'll be sure that you want to observe the abdomen. You want to inspect it. You want to auscultate bowel sounds, which may be normal, and then do your palpation light to deep. You also need to do a rectal exam and obtain a stool guaiac sample to see if they have an actual GI bleed. Several testing methods are used. You can do a urea breath test, which the patient breathes into a bag after drinking a special liquid. The bacteria changes the urea in your body to carbon dioxide. You need to do serology, CBC, or a CMP, which may reveal elevated liver enzymes, and an H. pylori serologic antibody measurement can be a definitive diagnosis. Acquisition of biopsies through endoscopy can also lead to a definitive diagnosis. Treatments for H. pylori include smoking cessation, alcohol cessation, and decreased intake of caffeine on the non-pharmacological side. On the pharmacological side, you want to be sure that they are treated with antibiotics and proton pump inhibitors. For those patients that are not allergic to penicillin, the first line treatment is clarithromycin and amoxicillin twice a day for 14 days. If that treatment is not successful, you would move on to the second line, which is levofloxacin, amoxicillin, and a generic proton pump inhibitor. For those patients allergic to penicillin, you would use clarithromycin and metronidazole twice a day and a proton pump inhibitor for 14 days. If that treatment is not successful, you would move on to the levofloxacin and clarithromycin and the proton pump inhibitor. After the second round of treatment, if you're not successful eradicating the bacteria, they need a GI referral. Patient education is important with these patients. The most important thing is that they take all prescribed antibiotics and medications and not stop taking them halfway through the course of antibiotics or medicines. Cease the use of tobacco products, including cigarettes, vaping, or smokeless tobacco. They need to restrict the intake of alcohol or caffeine-containing products, and don't take medications that don't belong to them. They need to reduce any unnecessary stress that they can when possible. If they have any other outlying illnesses, they need to be treated promptly. They also need to be sure they have plenty of rest and not skip meals. The most important thing too is for them to immediately notify the physician if they have any severe sudden onset of abdominal pain, chest pain, or they have any GI bleeding whatsoever. Thank you so much and have a great day.